Starting and maintaining quality conversations in relation to hematology on social media can seem challenging and maybe even overwhelming. And that is where Dr. Joe McHale comes in to share his advice. What advice do you have for those currently using any social media platform?
Well, thanks very much for a fantastic question. We just had an amazing session here on social media where a number of our experts were able to share their experience. A lot of advice came out of the session today, but I'd simplify it down to two quick things. Number one, be aware that what people are sharing is really genuinely public information. It's not just those who like it or comment on it. It's seen by many individuals, and we want to always, throughout what we do, remain professional, remain positive. Obviously, we can't, in much of social media, describe like we would in a full scientific paper, a concept or an idea. So taking time to think about it. We live in an instant age, and people can sometimes just tweet very quickly and not have time to think about it. So I really do encourage people, obviously, to do things in real time, but to take time to think about the fact that it's going out into the open area. The second, I think, very important point is that social media is not the same for everyone. I want everyone to develop their own style. We had some excellent comments today that you should determine your own style. Right down to how many minutes a day you want to be on social media, to do you want to share certain aspects of personal information. Many people don't feel comfortable with that, and there shouldn't be a compulsion. There shouldn't be a compulsion to answer every question that's ever asked. We can't do that. I think if someone takes time to think in advance, what digital image do I want of myself, or electronic image do I want of myself in social media before they start engaging, will really help them define their own limits so they don't feel that they're being driven by the bus as opposed to them driving the bus.
I think it's a great point you made, and it's also important for hematologists to really just be themselves. They're on social media as well. Add a little bit of your personality was another point that was shared. But what I do want to ask you also is, when you're on social media, what's maybe something that you really should just not do when you're on there?
I think I may have, during our session today, created a new hashtag, which was comment not vent. Hashtag comment not vent. And the point there being is, we recognize that social media is an excellent forum for good scientific discussion, but we also want to be professional about it. We want to be careful. There are some who will become very antagonistic and very angry, and that's not the place to do that. Dr. Modi shared that, for example, he has a personal policy that he would not reply to an angry email for 24 hours, that he embargoes himself. Again, another new hashtag, embargo yourself before responding to an angry note on social media. So I think that's a very important lesson, that we're there to comment, and the comment, of course, can be a controversial discussion. It can be opposing a view, but I think if it's done in a professional way, like you said, we are a group of physicians that, as we present ourselves, we want to do so with credibility.
That is some excellent advice. Thank you for sharing. Hashtag Ash17. A few more tips to achieve credibility on social media include: post comments, don't vent, limit how often you engage, social media is not an obligation, and avoid dispensing medical advice. Now that you know some social media best practices, start sharing. You may see your tweet here on the social media wall in Ash Central.
Exercise is a great way to unwind and can also relieve stress and prevent physician burnout. That was the topic of the ASH Practice Partnership Lunch. A December 2015 study from the Mayo Clinic reported that physician burnout is on the rise across all medical specialties. The most common complaints among today's practicing hematologists include delayed, inadequate, and reduced reimbursement, high staff turnover, poor recruitment and retention, and understaffing.
I think it's a really interesting question, because I think more of our hematologists look to find other ways of evolving their career. That some are going into the pharmaceutical industry, some may go into strictly research. So where will the caregivers come from? Where will the hematologist be who needs to take care of our sickle cell patients?
Some ways to overcome burnout include making time for hobbies, physical activity, and more.
Exercises on mindfulness, meditation, different exercises to develop coping skills. So I felt that was very helpful for me. And we reviewed this book called Awake at the Bedside. And Awake at the Bedside had a lot of different authors in there describing how they approach resiliency, burnout, compassion at the bedside. If you have depersonalization of the doctor and they're so stressed out they have compassion fatigue, then the patients will lose trust in their doctor. So it's really a big issue.